And now back to Open Mic Friday with Mike. And now TSPN presents Open Mic Friday with Mike Spence and Butter.
Thank you for joining us with Open Mic Friday, and we're back. I can't believe another week has gone by, and we have an exciting show today with a number of guests, but a very important guest to begin with, and that's Melody Montgomery, and she is the director of the Surgery Center, or Surgery Department. Mm-hmm. I'm going to get that correct because it's extremely important. The Surgery Department at Sutter Amador Hospital is different than the Surgery Center.
Yes.
And we're going to make sure everybody understands that because that's something that's new to me. I always get confused because you see the Surgery Center, and there is a different surgery department that has been developing with Melody's help and assistance. She's brand new to the county, and that's why we wanted to have her on the show today. Because it's extremely important that we have this new service at the hospital that people can count on. And I'm going to let Melody talk a little bit about the new hospitalist program. That's another word I was unfamiliar with, hospitalist. Mm-hmm. That's a new one. And I wanted to welcome you to the show, number one, Melody. Thanks so much for coming on.
Well, thanks, Mike. I am really honored to be here. I'm honored to be in Jackson. It's a fine little hospital that we have here that serves the community. And this new program is called a Surgical Hospitalist Program. Some people may have heard of a hospitalist program where the physicians are actually in the hospital 24 hours a day, 7 days a week, covering the patients that need care whenever there isn't a primary physician that has admitted the patient. And this is about the surgery department. So the surgical hospitalist is a surgeon who is on call 24 hours a day, 7 days a week for the hospital, the patients who come through the emergency room. And also they're setting up a clinic, so they're seeing patients on an outpatient basis so that you could actually have elective surgery with them and be they're available for emergency surgeries as well.
Quite different than what we used to have, where the surgeons you had to go out to Folsom or Sacramento, and if you had an emergency surgery or even an elective surgery, you had to coordinate that with surgeons away from the hospital. And, but these, when you say hospitalist, that means that they're actually contracted with the hospital directly and on staff there.
Yes.
Available 24 hours.
7 days a week.
7 days a week.
Yes.
That's an amazing difference.
It is. We've had the surgeons on call to the emergency room, and they're private practice surgeons. But this practice is directly connected with the hospital and is amazing. The surgeons are great. The response, they arrive to the emergency room or in their clinic, see the patients. We schedule them for surgery. Surgery's done. They see them post-op in the hospital. They'll also see them post-op in their clinic if it was an outpatient procedure. And they're ours. They're with us.
I will tell our viewers that Melody is the perfect person for this position. And the reason I know that is they had an amazing event the other night. It was an open house for the surgery group there. And they introduced some of the new surgeons who were the hospitalists. And Melody had a huge board. You just received like one of the most prestigious awards in the state of California, if not national.
It was a national award.
There were 5,000 people there
for
you to see you there to receive that award.
5,000 my closest friends.
And what a great recognition after a long career's worth of work. And being a professional is one thing, but to get that professional recognition and to come to Amador County, we're thrilled to have you and honored to have you here. You started off in California.
I did.
And then I was looking at your bio, and then you'd gone up into the Pacific Northwest. It didn't say anything about being a hockey mom.
But I was that too.
But you were up in Seattle and all over the area there, and then now you've come back to California, which is great for Amador County.
Oh, I feel it's one of the best decisions I've made for myself in a very long time. It's just been like coming home. It's close to my family, my son, my best friends are a lot of them are right here. And within
this is such an administrative position for you. I noticed in your bio it was like you were doing surgery and things. I mean, you were actually practicing and.
Oh yes, I started that way.
You started doing all the. I saw a lot of that activity, and it wasn't mostly administrative. It was practicing.
Clinical practice. I started as a staff nurse in the operating room, and I trained at Merritt Hospital in Oakland,
Oh, wow.
California.
There's some real life experience there.
Yes, and that was 40 years ago this month is when I first set foot in an operating room.
Wow.
And I just found a home there and found a practice that I felt like I could really dedicate my career to.
Wow, that's exciting to see the difference and to be in an administrative position, because you really do know hands-on.
Oh, yes.
What we need, and being able to kind of push that surgery group forward, and also within the community to communicate, that we have all that available now at Sutter Amador Hospital. It's just quite different than what we've had before. Now, there is a surgery center,
Yes.
which is completely different from the hospital.
Yes, it is
But
owned by the Sutter.
It has a similar
Health-
name to it, so
Yes, it's Sutter Amador Surgery Center, and we're the Sutter Amador Hospital Surgery Department.
Now, how could I get confused about that?
I know, it's very easy to get confused, and so it is good for the public to know that
Yes.
there are two entities, both providing surgical services. Sutter Amador Hospital has outpatient and inpatient surgery services. Sutter Amador Surgery Center is strictly outpatient.
And now with the hospital, you have all different types of surgery, not only elective surgeries, but, babies being
Oh,
delivered.
yes.
And you have a different type of pediatric department too as well for kids.
Yep. And we have, the surgery department does the C-sections for births, and we're on call 24/7 as well. So there's always a surgical team available to respond to any emergencies
So
that
that's
are needed.
improved too here locally in terms of delivering babies.
Oh yeah, we've had
being able to
that
do
all
all
along,
that.
and I think the difference is that we have a surgeon that is really dedicated completely to Sutter Amador Hospital.
Good, that's good to know.
Yeah.
This is my adopted home, Amador County. As you've come back, I came about 10 years ago, but I had a health issue with a blood clot, and I ended up in the emergency room. And not to talk about me for the whole time,
No,
but I do all the talking on my show.
That's why they call it open mic.
That's what they call the mic. It was a blood clot, and it got up into my system, and Dr. Hartman actually saved my life. I was in the hospital for several days, but, I was questioning. I have relatives who are doctors at Stanford, and, I was thinking, where's the helicopter pad? If it's that serious, fly me down to Stanford.
Yeah.
I had no idea what services were available at Sutter Amador Hospital, and I was not only pleasantly surprised, but, it was like brand new, and the staff and Dr. Hartman, he's not the best doctor in the county, I found to realize, but probably the best doctor on the planet.
Yes.
And so I was very fortunate, and not knowing anything about Sutter Amador Hospital and learning is a big part of the communication. So you have your hands full. It's a big responsibility in getting that out there, and we're going to have you back on the show and talk more about a lot of the little details, because I know you have a lot of different things, but I wanted to just welcome you to, Amador County.
Thank you.
Melody, it's just great. And my wife really likes you, by the way, from the party the other night. And
I appreciated
you
our
made a real
conversation.
friend. You're on our party list,
Oh,
as if
great.
we had a party list, but we'll make sure you're invited. We love the hospital.
I'll be there.
We want to make sure we do everything we can to do what's best for Amador County and let people know what's going on over there.
Well, I appreciate the opportunity to greet the public and let them know that we're here for them.
Great.
So,
Well,
thank
we
you.
want to make sure everybody stays tuned. We have the girls from Hellwig. After you're done with your surgery, you need to run out to the wine country.
Have a glass of wine
Have a
and
glass
celebrate.
of wine, celebrate. We have them coming up, and we have the butter break. Butter's going to come on. I'm going to have you stay for butter because I know you're an animal person,
I know,
and we've talked. And we'll be right back with the butter break, so please stay tuned.
You're watching Amador County's local television network, TSPN.